Hi everyone. Today I'm here to speak about the roller coaster. No, I'm not talking about the amusement park ride, a roller coaster. I'm talking about the blood sugar roller coaster. Most of you will be able to relate to this in some way or another, as we all experience this to some degree. But essentially what the blood sugar roller coaster is when you eat something and then your blood sugar spikes, and then after you eat, your blood sugar will dip. And then you'll eat something again later and it'll spike again and it'll dip. And it will continue to do this throughout the day, depending on what you eat and how frequently you eat. Everyone is going to vary in terms of how much the spikes are and how much the dips are. If someone has really good blood sugar control, they'll be able to maintain almost close to neutral throughout much of the day. And that would be the goal, is that depending on what you're eating, you're not getting as many spikes and you're not getting as many dips. So why do I care about the spikes and why do I care about the dips? Because in the time when after you eat something and your blood sugar is dropping, that's when you tend to feel like crap. So you're tired, you're lethargic, you want to go have a nap. It's like after you eat lunch, you're exhausted and you don't want to keep doing your job. For some people, that can also manifest as anxiety. You know, we all have this sensation of when we eat a chocolate bar, we get really excited and anxious. Then the other side of that, though, is when you feel low. So for mood symptoms, like depression and anxiety symptoms, having really good blood pressure control is extremely important. And so it's not all just about diabetes. There is this concept of insulin resistance that happens before you get diabetes. And so type 2 diabetes is what I'm specifically speaking about. So this is like the late onset type diabetes. And so conventionally, diabetes and blood sugar levels usually aren't starting to be screened until someone's, in their late 40s or like early 50s, unless they have any red flag symptoms. In my practice and amongst many other integrative care providers, we're encouraging people to get things like their fasting blood glucose and their fasting insulin checked much sooner. So I'm checking those in people, as early as in their 20s, especially if they have anxiety or depression. Or if there's some other co-occurring symptoms, like hard time losing weight or other types of chronic concerns. And what we do about this is we try and strategize to try and make it so that that blood sugar curve throughout the day is more stable. So some things to do, number one, eat regular, consistent meals. No, you don't need to eat breakfast, but most certainly the first time you do eat in the day, whether that's at 6 a.m. or 12 p.m., you just have to make sure that that's a well-rounded meal. So that would include having an adequate protein source, making sure it has adequate fiber, and of course, vegetables for some carbohydrates. By doing that, you're going to actually see that you're not going to get as much of a spike and you won't get as much of a dip, as long as you do have like a protein and a fat component to those meals, because protein and fat collectively make it so that you don't get as much of a spike because the carbohydrates and the sugar in the meal are going to absorb slower. So that's one of the best ways to manage someone's blood sugar, is just strategizing their diet throughout the day. Sometimes snacking is helpful for people. I'm indifferent whether that's like a really good thing to do, a bad thing to do. I always just kind of talk to the individual sitting in front of me. Some people feel good with snacks. Some people are great with just 2 bigger meals in the day. But I would encourage you to find something that works well for you. And then also get the other blood tests done. Get your fasting glucose done. Get your fasting insulin done. Find out if you're spiking and you're dropping and if you're not actually having good blood sugar control. Because long-term insulin resistance, as I mentioned before, can lead to type 2 diabetes and many other types of chronic health concerns, heart attack, stroke, puts you at a bigger risk for autoimmune diseases if you have poor blood sugar control. So you really just want to manage your blood sugar as much as possible. And I hope that you're able to get off the roller coaster. Any questions about this, let me know in the comments below. But I hope managing your blood sugar better throughout the day helps improve your mood and your energy and lowers the feelings of anxiety. Enjoy your day. Bye.